Hi, my name is Sadia Khan. I'm a third-year psychiatry resident at University of North Dakota. For the Twitter Journal Club this week, I'm going to be summarizing the article, The Risk of Head Injuries Associated with Antipsychotic Use Among Persons with Alzheimer's Disease. So for this study, a cohort study design was used, examining community dwellers in Finland that had received an Alzheimer's disease diagnosis between the years of 2005 to 2011. The participants were not contacted and they were de-identified. Data sources used were from hospital discharge and prescription registrars to examine data for inpatient long-term stays, as well as dosing and dispensing dates for prescription medication. For the antipsychotic use, the PRE2DUP method was used for drug use periods, and changes were allowed between antipsychotics, and they were adjusted for risk based on the IPT weighting model. For the outcomes, hospital discharge registrar was used to look at admission or death data for TBI or head injuries. For exclusion criteria, any antipsychotic use with long-term hospitalization or institutionalization within 1 year prior to antipsychotic initiation were excluded. Also, any diagnosis of schizophrenia, schizotypal delusional disorder, or bipolar disorder at least 5 years prior to Alzheimer's disease diagnosis, and any previous head injuries. After the exclusions, there were 21,795 incident antipsychotic users that were matched with the same amount of non-users. The controls that were used were age, sex, and time since Alzheimer's disease diagnosis.